Psychoanalysis and homeopathy. Why is net mure? Homeopathy is a phenomenological system. Psychoanalysis is a causality-driven system. It's profitable to study the confluence of the two. One way to do it is to study why personality of a given person that we classify as net mure or ignitia or any type, why is he what is he? That is done in great details by psychoanalysis. Today we'll explore the confluence of psychoanalysis and homeopathy on the specific point of elaborating a psychoanalytic explanation of why is net mure. And in the process, we'll be touching upon tangentially all the issues and the subjects that come up as we go along the central path of our discussion. With me today, from the side of homeopathy, is Dr. Suman Bhagat. Namaste.
Namaste, sir.
So with her, we will start the discussion. I will now hand it over to her to structure the discussion and initiate the process.
Namaste, sir.
Namaste.
So can we roll out the canvas by stating the context of phenomenological and causal system?
Homeopathy is a phenomenological system, not because Hahnemann wanted it to be so. And psychoanalysis is a causality-driven system, not because Sigmund Freud wanted it to be so. The two systems are what they are because the central discovery around which these systems are built, that nature of central discovery was such. And therefore, what we see today is that homeopathy continues to be largely a phenomenological science, and psychoanalysis continues to be a causality driven science. As we look at the phenomenological and causal systems, so we were on the point that the nature of discovery was such that one turned out to be a phenomenological system, the second turned out to be a causality driven system. The focus therefore is very different. Like the central question that any homeopathic clinician will ask is this person net mure? Who is net mure? Whereas the same person going to a psychoanalytic therapist, the therapist will ask the question to himself, why is he net mure? What happened in the first year of life, second year of life? Is it affect repression? Is it some phenomena where he is arrested? Why is he net mure? So for the practicing homeopath, the core is he net mure? If yes, I can prescribe net mure to him. But for a psychotherapist, the core is why is he net mure? So the two approaches are different. Phenomenological system.
So psychoanalyst will also try to find out why he has become net mure.
Yeah. He will go into the causality in terms of the early childhood phenomena. What phenomena took place in his unconscious mind that today he is net mure.
Okay.
Right. So his primary interest will be in that causality because his method of healing is based upon that causality. Whereas the homeopathic system is essentially based upon identification, not so much of the causality of why he is what he is.
Yeah, not as a detail as a psychoanalyst go.
Correct.
But I think that from Even homeopath also try to find out why he has become naturomute. But I
Ha,
think psychoanalysts go in a much deeper at the core level.
correct, correct. So in homeopathy, what you will have is generic exploration of causality, not a very detailed and unconscious exploration of causality. So at
Right,
some level,
right,
it will be there, but it will not be as detailed because in psychoanalysis, the whole system is centered around it.
right,
So that will be a fundamental difference. That the moment you call something a science, there is going to be cause-effect relationships. You cannot have a science free of
that is
causality.
true.
But the difference between
That
the
is true.
two systems is this, that in phenomenological systems, the causality is circumstance-based causality. Whereas in causality-driven systems, it's a elemental based causality. That there is some elemental,
Right,
maybe a affect, maybe a thought, maybe a phenomena, which is cause of X. So when you
right,
get into very detailed, exact causality of at an elemental level, that elemental may not be a symbol of the philosophical world. It may be a phenomena, it may be a effect, it may be a blocked thought, whatever it is. So in that sense, you will always have some causality in a science. So the moment you say there is a phenomenological system, it is essentially a soft science. And when you say a causality based system, it can be either a soft science or a hard science. When a causality
right,
driven system becomes empirical, it becomes a hard science. But till it remains causality driven in its own internal system, or it remains causality driven in conceptual terms, it remains either a soft science or a half hard science. So allopathy that way gets classified as a hard science because the causality is very elemental and biochemical, empirical. In psychoanalysis,
right,
there is causality which is conceptual, it's not empirical. So it will not be considered as hard a science as allopathy. It will be a half hard science, or some will even call it a soft
right.
science. Now, the goal of any phenomenological system will ultimately be to become a hard science. So that phenomenological status itself is a work in progress because at some level we don't understand certain basic things. Like in this particular instance, the ununderstood thing will be how does exactly the remedy work? That is not understood in very elemental, clear and causal terms. So there is a conceptual explanation of it, not an empirical explanation of it, or not even a conceptual causal
Right.
explanation. So that is where the two systems are different. And if we look at uh, systems of healing which prevailed across history, we will see both phenomenological systems and empirical systems and causal systems uh, across history of the human race. Interestingly, in pre-modern times, before the era of modernity set in, we had more phenomenological systems which were largely indigenous and less causality driven systems. After the advent of the modern era, the systems which have developed or discovered are largely causality based and few of them are phenomenologically based. Interestingly, Ayurveda in this area is a strange hybrid creature that in one
Okay.
sense it's a causality driven system. If you go into details of it, of the five Vayus and five Agnis and the whole elemental
Mhm.
model of the human system that it creates, then it looks like a causal system. Causal not in the empirical sense of allopathy, but causal in its own conceptual terms. But the moment you get into certain
Right.
parts of Ayurveda, like classification of personality into Kapha, Pitta and Vata, or healing by Panchakarma, or bringing in astrology or karma or past life, it suddenly, that part of Ayurveda becomes more phenomenological. So it's a very interesting hybrid kind of system from the point of view that we are talking about.
Right, right. So why to synthesize homeopathy and psychoanalysis?
Uh, because both stand to profit from it. And the profit is like this. The first profit is in terms of typology. For example, if you go in the periodic table from lithium to the right, you will see reducing dependence. Then at some point you will see healthy situation, and after that you will see pride. From psychoanalytic standpoint, we are talking about reduction in dependent personality disorder, then 1 or 2 points of health, and then narcissism.
Okay.
So if you look at before the point of health, you have 3 or 4 elements which all are different shades of dependence. Then what we
That's true.
get in psychoanalysis is a typology of dependence with characteristics of each typology that homeopathy has discovered. Similarly,
Right, right.
in areas that we cannot do anything, or the patient is not cut out for psychotherapy, because everyone is not cut out for psychotherapy, or he cannot afford or does not have time, then there is an alternative way of healing it, which is homeopathy. That gives us an additional healing route. The third is it sheds some light on the causality, because some of the things that the proving throws up is something which is new and gives us some idea about what is going on in the unconscious mind. Some of it may be hidden and may not come up easily. So that is the additional third part. And the fourth part is related to how the movement happens. That as the movement happens towards healing, what is it that is increasing or reducing? So that also we can see from the movement in that table. If you look at it from the other side, from homeopathic side, then psychoanalysis has its own typology, which can be very profitably used to apply on these classifications. Like just as I said, that in that line, you will have, if you look from dependence point of view, you will have dependent personality disorder, 2 healthy points, and then narcissistic personality disorder. If you look at it from self-esteem point of view, you will see deficient self-esteem, 2 healthy self-esteem, 2 narcissistic self-esteem.
Right.
The second part is about the causality and phenomenological knowledge that psychoanalysis brings, because often uh, those things don't come up in the case taking. Many of them don't come up even in proving. So that psychoanalytic component that helps. Then there are tricky parts. For example, somebody is feeling anxious. Now, is it anxiety per se, or is it a cover for sadness or aggression? Now, this has been studied in great detail by psychoanalysis, how and ISTDP, how affect can be a cover for a real affect which is covered up. So the presenting affect may not actually be the real affect we have to deal with. And the real affect is what is covered up by the presenting affect. So those kind of what I call the sandwich of affect, those things are very well studied in those parts. Then we come to dream analysis, it's an area of great detail in psychoanalysis. So those are the elements that can go actually into uh, homeopathy. And with advent of this idea of superclass, this flow will become even more lucid and profitable, because the moment you come to the idea of superclass, you are talking of a dynamic. And
Right.
psychoanalysis is completely based upon ideas of dynamics. But the dynamic will not be as it is listed at present, because psychoanalytically, when I look at the superclasses as they are described now, the feeling that I get is very soon you will have to increase the number of superclasses and reword them.
Okay.
So it will, when you put them together, you will actually refine the superclass concept into something new, which is yet to come. So that is one part. The second part is, if we look into homeopathy, then if you put aside the ideas of materia medica and repertory, rest of the ideas are not empirical, they are inferential. The right brain ideas of miasms, of kingdoms, of uh, subclasses, superclass, and so on. Those are conceptual ideas, they are not observations. So if you add one more conceptual idea of the psychoanalytic window, then you have one more way of refining the search. Like many people talk about remedy being seated in the center of the room, and the room has 7 windows. The window of materia,
Right.
the window of repertory, the window of kingdoms, the window of class, subclass, and so on. And when from all the windows you see the same remedy, the probability of that being the right one is very high. Now you can add one more window of psychoanalysis because it's one more right brain concept, the non
Right.
observational
Right.
concept. So those are some of the
Right.
ideas where the synthesis will be profitable. And one more thing is, if we look at the movement of any phenomenological system to a causal system, it can happen in two ways. One, you can jump directly to an empirical causal system, or you can move to a intermediate conceptual causal system and then go empirical. So at present, what we see is that some thinkers in homeopathy are trying to jump directly to the empirical part. Like if they take up a remedy and they say, which neurochemicals is it influencing? That kind of a study, that is jumping from phenomenological to empirical causal directly. My feeling is that it's probably from a complete framework point of view, it's better to go to an intermediate conceptual stage, synthesizing with psychoanalysis, and then go empirical. Otherwise, what you will have is
That is true.
too many correlations without a full rounded picture, too many
Okay.
elemental empirical data without them getting into a coherent story. So that is one more area where I think in this journey of homeopathy, from phenomenological to causal, you will have an intermediate state of conceptual causal using psychoanalysis or other forms of psychology, and then going empirically causal. So these are some of my ideas why it is profitable to confluence the two.
That's true.
Anything passing by? You're thinking something?
I think there's some problem in network.
Okay, okay. कोई बात नहीं.
Hello.
हाँ, can you hear me?
So now coming back to why is natramure and how do we develop this concept?
Um, this question can be looked at from two ends. Why is natrum mure natrum mure? One, you can ask, why is remedy natrum mure natrum mure? And second, you can ask, why is the person
Yeah,
natrum mure natrum mure? Now, if you ask the question, why is remedy
right,
natrum mure natrum mure? That's a separate question altogether. That is not something psychoanalysis can answer, because that will get into
right,
areas of material science and what material characteristics produce what potentialized characteristics. That's a separate area altogether. What we can focus upon is, why is natrum mure person natrum mure? So
right,
if we go into the causality aspects from psychoanalytic point of view, the story of natrum mure, a generic story of natrum mure will be like this, and there will be additions, deletions, modifications based upon person to person. Right? But the generic story of Natrum Muir is like this. Natrum Muir will have very good experience with the mother for the first few months of his life. And that will create the core of goodness and strength in him, because of which the chances of a Natrum Muir going psychotic will be low. From a psychoanalytic standpoint, he
Okay.
will largely be in the neurotic range. Occasionally going into the psychotic, not psychotic range, but occasionally going into the crisis range, but coming back. Because first few months he will have good experience with the mother. Thereafter, a traumatic event will happen. And this thereafter is between 3 months to 1.5 years, 15 months. So between 3 months to 15 months, a traumatic event will happen. And the earlier it happens, more will be the fragility and more will be somatization.
Okay.
And when this traumatic event happens, the nature of the traumatic event will be like this. One, it can be a loss. Loss can be real in case of orphans or those children who have been deserted by the parents. But largely it will be perceptual, that the mother is not available for a period of time and the child perceives it as an abandonment. And the trauma of that perception is so high that when the mother returns, it is not undone. It remains largely intact. And the undoing of that trauma by the corrective experience is of very low order. And this traumatic incident, which may be either of the nature of loss, or if the mother is attacking the child, or if the mother is cold, what we call the refrigerator mother, or the mother is herself depressed because of postpartum and the child experiences a dead mother. Any of these can be traumatic events. And this happens
Uh,
between 3 to 15 months. Please.
so nowadays, as every woman is a walking woman,
Hmm.
so this stage is the chances of this stage is increased then.
Yes, that is how culture breeds pathology. And this was brought up by Heinz
Yeah.
Kohut when he said that the type of patients Freud used to see and the type of patients Kohut used to see were very different because social conditions were different.
Right, right,
So this whole idea of nuclear family, this whole idea of working parents, they are themselves the cause of large set of pathologies which we see across society. Like today we see narcissism, dependence and fragility and histrionicity so widespread.
right, right,
Fragility is across and you see a very high proportion of narcissism, dependence, histrionicity. And much of it has to do with the working mother starting working very soon. And
right,
that is where the rights of the child and the rights of the woman, they are in clash. And there is no win-win situation.
right,
So that Netmure experiences that. And what happens is the moment it happens, this traumatic event, Netmure experiences development of some form of personality disorder. And that is between 3 months to 1.5 years, at the most 2 years. After that, Netmure goes into the anal stage with already that problem created in his mind. So he is going through psychosexual stages not as an innocent person, a normal person with already loaded with pathology. So in such cases, what you see is in the anal phase, you will see very high sadism of Netmure and very high split action of very high concern, care and protection for some objects and extreme cruelty to some objects. And often that cruelty is to small ants or they put it on their toys. But you will see this split. extreme protection of some objects, and cruelty on some objects. And then he goes into Oedipus, and in Oedipus he is already going with so much load, the chances of resolving the Oedipus are very low. So there he gets entangled in the Oedipus. And each of these entanglements has an adult symptom. That the early trauma will have a symptom of either fearing attachment. Right? So he'll be caught in this, I want attachment, but I fear attachment. So I want attachment, I don't want attachment. He will be caught because of the early loss, because he will fear loss all his life. Right? Then the sadistic component will often come along.
So that means this loss makes the nocturnal person a reserved personality?
Yes. He is afraid of emotional closeness because he fears that closeness will ultimately lead to abandonment, just as it happened in childhood.
Okay.
And that pain of abandonment will be unbearable. So let us not do it. So there is a clash between the natural desire to be close and the learning from experience not to be close. So nature and nurture are loggerheads with each other, and there is an emotional traffic jam.
Right.
I want attachment, I don't want attachment. Right? So Netramure will be caught there.
Right.
Then he will be caught in the unattenuated sadism, which will come out in his intimate relationships. That will also come out when he shouts at others. It's completely unattenuated. He does not know calibrated shouting. Right? So he will repress for a long time and somatize, but the moment he explodes, it's uncalibrated, which often he will later regret. Then he comes to the Oedipal problems, and Oedipal problems result in difficulty in sexual performances. So there is a range of sexual disorders which will come in, and difficulty with authority figures.
Right.
That the fear of authority figure will be very high, and there is fear per se of going close to any human being. So there is avoidance of human beings to a large extent. And these things, they create a template which socially is dysfunctional. That with this kind of characteristics, you cannot succeed in society because you don't have the social skills. That creates additional frustration because the narcissism which is inside is frustrated by non-success. And non-success is because of templates created by these early things. So that will go on. And then after the Oedipus, most of them will have a difficult childhood where the problems of 0 to 5, instead of being corrected by good experiences, they will be accentuated by difficult experiences. So they will usually have a difficult parent. Either both parents are difficult, one parent is difficult and the other is absent. That kind of situation will lead to the personality of Netmure. And what will happen is, at puberty, what was bottled up till 0 to 5 will again spring up, and usually the chronic difficulties of Netmure will start at puberty.
Okay.
Right?
Interesting.
And that will go on, and it will go on for quite a long time. And this will create a very difficult situation in the midlife. Professionally, of course, as we said, he is going to have professional difficulties, personal difficulties, but midlife will be most difficult, because in midlife, a huge amount of mourning will have to be done for the dreams not realized. And the narcissistic structure and high sensitivity will not allow it to happen. So midlife will bring a lot of depression. It will create intensification of somatization. So whatever is somatizing, the somatization will go up radically. And at the same time, he will actually experience loss of grandparents or parents, because he is middle-aged. The parents and grandparents are now elderly. So that will create additional load on him which he cannot process. And as Freud says, when you lose somebody to whom you are ambivalently attached, it results in more depression. Because anger towards that person now becomes anger towards oneself.
Right, right.
So this will lead to more deterioration of his symptoms. And if rightly he is given homeopathy or psychotherapy, much of it can be reduced. But not done anything, this will be the
Right.
psychoanalytic understanding of the way his characteristics go. And each of this trauma that we talked about will give rise to 3 or 4 symptoms, 3 or 4 characteristics.
Right.
So this is the generic story of Netmure, and then there will be specifics like, is the Netmure coming for, let us say a Netmure comes to you for depression. Now one Netmure will be driven by sadness driven depression. Another Netmure will be driven by guilt driven depression. Third will be driven by sadness, anger driven depression. So those specifics will then vary. Okay, what is repressed more, what is somatizing more, what can be expressed out, and what is bottled up inside. That is more to do with the specifics of the life situation.
Right, right.
So this is one part. Now we have 2 minutes to go before this session ends. Let me just make one comment. When I say psychoanalytic story of Netmure, right? In psychoanalysis, we have 7 to 10 different schools. So each school will have a different story. But what I have given you is a consolidated story.
Okay.
Now, if you go only to Freud,
Right.
he will give a different story. Klein will give a different story. Kohut will give a different story. But if you put together, the consolidated story will be what I just put across.
Right. Very nicely explained, sir. Very nicely.
Uh, we have 1 minute to go. Should we do the rest of in the second part?
Yes, sir.
Okay.